Hi, everyone, and welcome to the Lipedema channel. I'm Brenda Viola from Lymphopress, and we love to bring you inspiring interviews or informative interviews from the lipedema community, not just patients, but also medical professionals. And I live a lot on social media, and I have heard chatter about a new practice, maybe not so new, but new to a lot of members of the lipedema community. They're very excited that Dr. Beidas is now in Orlando. So welcome, Dr. Beidas. Nice to have you here.
Thank you, Brenda. It's very nice to be here.
So tell me how your journey led to lipedema.
So it actually, I kind of fell into it, to be honest with you. A couple of things. So, my training, I did a special fellowship after my 6-year training in plastic surgery. I did an extra year in body contouring, which is plastic surgery after weight loss. And so I came to Orlando to set up this practice. I work for Orlando Health, and I was very fortunate to be hired by them. And they were very excited about building this program. And so a couple of things happened after I'd been here for about a year. One is one of my partners, there's 5 of us here, one of my partners that did a lot of lymphedema, and he's been building a lymphedema program. And he gets people from all over the world now who come see him for lymph node transfers and treatment of lymphedema. And so what was happening was he was seeing some lipedema patients, and he was treating them. I think kind of maybe for a lot of the reasons that other surgeons do is they just kind of see them and want to help them. And at the same time, what happened was seeing a lot of weight loss patients. I was seeing some patients who would come in and tell me, I'm doing everything I can. I'm dieting, I'm exercising. And you look at them and you see a skinny woman, above the waist and then big legs. So kind of something that's not very proportional. And so I started thinking, well, this is strange. You are doing everything. I'm looking at their protein, their fluid, their exercise. And then I started doing some reading, and by talking to Dr. Klein, who's my partner, I was like, well, I think a lot of these women have lipedema. And I think a lot of women who have lipedema are told, as we all know, that they're obese and need to lose weight and this and that. And so many of my lipedema patients have had weight loss surgery. And so I wanted to help them. So he said, since you're kind of the soft tissue, fatty tissue expert, I trained with one of the kind of experts in fat transfer and liposuction in the world. So we said, you know what, why don't you do lymphedema? I'll do lipedema. It kind of fits, and here we are.
Well, it is an amazing journey, and many of the people I've spoken with, from Dr. Schwartz on the West Coast to many other practitioners and surgeons, it wasn't a direct path, but there was a need. There was a lot of patients, and nobody was helping them. And this remains an undiagnosed and often untreated condition. How can we change the tide?
That's a great question. I think the unfortunate truth is it's just going to take time. I know that Dr. Schwartz and Dr. Herbst have now teamed up, which is great, and they're publishing articles. I think they've put out 3 or 4 so far together. I think that's the first step. I think doing these types of events, social media talks and interviews, and getting the word out that way. We, as part of my team, so we actually are starting a lipedema clinic. Next month is going to be my first one. And I also recruited Dr. Klein, my partner. So we're going to do kind of a combination lipedema clinic. And we have therapists now built into our office. And they're going to be there, of course, on that day as well. They're there every day. So then, it'll be really nice for patients who can come and see the surgeon. If you have lymphedema, you see Dr. Klein as well. And regardless of what you have, you'll see a therapist the same day. So kind of a one-stop shop. I don't think anything like that exists out there.
I think that's what's captivating so many people about what you are doing here, because I speak with a lot of women. Some of them absolutely are not interested in a surgical option. Some want to try whatever they can holistically. Others are very much in favor of surgery. It seems like this collaborative effort means that there is something for everyone, no matter what course of action you want to take.
Yes, and actually the next part, and we've been working on this for a year, but with COVID, it was put on pause, is to get a primary care doctor to see these patients and I guess in one sense triage them, to figure out, do they need to see Dr. Klein, or do they need to see me, or maybe someone else. Some women have venous. That's probably more for the lymphedema side. I think most women with lipedema, it's kind of clear cut. Um, and also to help treat, diet, weight management if they need help with that, help with exercise and kind of routine. So that's hopefully the next step for us is to hire someone. We have identified someone, but like I said, with COVID, it's kind of been on pause. So.
Yeah, and I receive so many emails from patients saying, where can I find a good doctor that will diagnose me? Do you do telehealth at this point?
I do. So today, actually, it's not my normal clinic day, but because we're getting slammed, I'm doing an extra clinic now in the month. And I saw two lipedema virtual visits today, and then two in person.
So is there more talk in the medical community about lipedema so that it doesn't remain so unnoticed or
Uh,
misdiagnosed?
Sorry, yeah, I think so. I mean, it definitely seems like it's becoming, or things are coming around, the tide is turning. But I think it's still a small subset of doctors and therapists. Doctors, both surgeons and primary cares or endocrinologists, or let's just say non-surgeons. So I think it's going to really be a slow, kind of a slow turnaround or slow tide before it becomes really widespread. Unfortunately, I wish we could find a way to speed that up, but I don't know that that's possible.
Well, the more people there are like you and Dr. Herbst and Dr. Schwartz and Dr. McCutcheon around the country, the more vocal you are and active and getting the word out that this is Lipedema Awareness Month. So it's appropriate that
Right.
we're talking today. And
Exactly.
this month also, the standard of care for lipedema was issued and finally published, authored by Dr. Herbst and many others. Do you think that this standard of care can be an important component in helping to raise awareness? And Dr. Herb Stevens said today, I encourage patients to walk into their doctors with this standard of care so that they understand it better.
Yeah, I think that's been great, and I think it will be instrumental because first of all, it's a free article, so anyone can access it. I think that was huge, whether they did on purpose or whether that's just the way that journal that published worked. But you're right, patients can look it up. Any doctor can look it up if patients don't know how. And you're right, people can take it into the doctor's office. So that might kind of help, speed that process up and get people educated, because the patient can take that article, walk into their PCP's office, and even if the PCP knows nothing, we all know how to read. We all went to medical school, so we know how articles work, and data is data. So that's definitely a great first step to kind of getting the education out there.
I agree. I think it's a wonderful leap forward, and we've made great strides. I talked to a woman who was initially told not to exercise because it would make the condition worse. And all it did was make her more immobile. Now she's running and leading triathlons for the lipedema community, which is amazing. And she's vibrant and alive and living a better quality of life. I want to ask you this. Do you have anything special about your approach or your surgical procedures? I know that there are some surgeons who have actually trademarked their kind of procedure. Is there anything unique? Because we know that regular liposuction isn't what you use for lipedema.
So there's no, I definitely haven't done anything special, I don't think. I think at the end of the day, the mainstay of treatment is taking out the lipedema. And whether you do that with liposuction or with, larger incisions and directly cutting it out, um, the goal is the same and the end result is the same. There's certainly areas I always warn patients. Some areas are really nodular and hard, and liposuction will just not treat that. So you have to make larger incisions or larger scars to get at the nodules and get them out. Um, I know a lot of people advertise water assisted and ultrasound assisted. the gold standard, and well, so first of all, for lipedema specifically, there's really no good studies that have compared head-to-head one to the other. And until we have these larger clinical trials, I don't know that anyone can really say, my technique is better or this is better. I do use standard liposuction sometimes with power, but I don't use any assistive devices. I'm not sure that there's enough data to say that it's any better than the gold standard, which is just traditional liposuction, suction-assisted lipoaspiration.
Yeah. So it is a very specialized procedure. Who makes a good candidate for this, or are there any hard and fast rules?
Um, I think any patient with lipedema is a good candidate, barring any major health conditions. I would say, fortunately, really haven't encountered any patient we've not been able to take to the operating room if that's that's what they needed or that's what they wanted. We work closely with their primary care physicians. We typically get clearances on, if I'm not mistaken, every patient I take to the operating room, because these are pretty major procedures. I mean, it's funny, we talk about liposuction, and I always tell lipedema patients, we're using the word liposuction, but it's not liposuction in the sense that we're going and doing a little bit of touch up. Like with an abdominoplasty, you do a little here and a little there. We're talking large volume, several hours in the operating room. So we really need patients to be fit and healthy and not have very many medical problems.
Yeah. So do you have any
Um,
recommendation? I'm sorry, I didn't mean to cut you off. Was there more you wanted
I
to
was going to say, so we don't really have a hard stop. I know data from Europe says, or there's some data from Europe that says that weight loss surgery is helpful. Data from the U.S. or articles in the U.S. say it's not that helpful because lipedema is really resistant. I would say patients who come in and have a really high BMI, I think those are patients who maybe should consider, some kind of weight loss surgery, because while they may have lipedema fat, we all also carry normal fat, adipose tissue. And those patients, just as a result of their BMI, might be at extra high risk of complications by undergoing general anesthesia. So, but I struggle with those patients as well, because what is bariatric surgery the right answer even for those patients? And the answer is, I don't think we know yet.
Well said. I have immersed myself in the lipedema community for the last year and a half or so, and my heart goes out to these women. It's primarily women, as our audience well knows. Many of them are just seeking some sort of hope, because how frustrating is it? We just heard today 25% struggle with depression, and how depressing it can be to diet and exercise and see nothing change. So there's also the mental health issues associated with this condition as well.
Yeah, it's you're absolutely right. It's a yeah. I can't imagine, myself, if I were someone who worked out and dieted and exercises and did all these things. It took a lot of effort, and then you look in the mirror and it's the same. That's it's definitely a big component of lipedema too,
Yeah.
and that's probably something surgeons and non-surgeons need to consider when evaluating these patients.
So many of the physicians that we work with and surgeons use the lymphopress before and after surgery, pre-op and post-op, to help recovery. I know that there were good 3 paragraphs in that standard of care about pneumatic compression. What is your view of pneumatic compression?
I think it's vital. I don't, we always tell patients I tell patients my part's easy, right? I spend 4, 5, 6 hours in the operating room, and then my part's kind of done until their next stage if they need one. So I tell patients, your occupational therapist or physical therapist, lymphedema therapist, whatever we call them, that's going to be your best friend. And the way we've developed the program, when we first started, as you know, we get people from all over. And if they were local, we really like them to see our therapists here, because they're very experienced in lipedema and compression and lymphopress or other devices. But then we started running into the problem when people were out of town or even were local and saw other therapists that they just weren't as educated if they're not familiar with lipedema patients, and then we would take them to the operating room and they wouldn't have good post-operative protocols or good post-operative care established. And then, their kind of treatment course would fall apart. So the new guidelines, at least we've established for our practice, is if you're local or if you're out of state, you have to see one of our therapists at least once. If you have someone at home or you don't want to use one of our therapists because you're local and you want to use someone else, or you're out of state so you can't use one of our therapists, they'll do a video visit and then they will coordinate with your home therapist and guide them. Because we found, like I said, that not very many therapists. It's kind of it's a bottleneck with many things, right? There's the primary cares, there's the surgeons, and then there's a therapist as well, where there's not very many people out there who treat this condition. So you have to kind of help those who don't educate them.
Do you have any particular success stories? You don't have to name names, but does any particular instance come to mind where you were able to make a real difference in this patient's life?
Yeah, two, maybe just because they're two relatively recent ones, kind of immediately come to mind. I had a lady yesterday who I did her second stage, and after her, she was telling me how even after her first stage, she said, I went biking again and it wasn't painful, and I went on the elliptical and I could finally walk and exercise and do all the things where, just lifting my legs a little bit were almost excruciating, and now, she's biking a few miles a day, which is great. The other one was a lady who had surgery outside. So I think as I've gotten, primary patients now, I'm getting a lot of revision patients, maybe in the last year or so. So this lady had surgery done by an outside surgeon, was really aggressively over treated, to the point where you've got skin and then you've got your fatty layer and then there's muscle and fat, or fascia and muscle underneath that. And she was skin on muscle because that surgeon just, way over treated her. And so we were fortunate to be able to submit to insurance for her revision, but also to go back and do fat transfer or fat grafting into that area that was over treated. And we did her maybe 2 weeks ago. And, of course, it's still too early to tell what's going to take and what won't, because you don't keep all the fat that we transfer. But she's doing well, and she's really happy with the results so far. So that's always a good feeling when patients are happy.
That's so gratifying. I got an email the other day. A woman finally got her LymphaPress LymphaPants, of course, that go all the way up under the chest, and her Optimal Plus. Dr. Beidas, within 2 weeks, she lost 13 inches.
Wow.
He has not had any success with, now we understand there are many tools in the toolbox. LymphaPress is one, but we were so, we were sharing this email around the office because it's a source of joy for these people that have had very little hope. So I applaud you for the work you're doing. If you know that there's a lipedema patient out there listening and looking for hope, what would you say to them right now?
I would say, first thing, hope is definitely something, you've got to hold on to. There are people out there who want to help. I think you just have to find, I think it'll probably all starts for every patient with one person, whether it's a doctor, a family member, a therapist. I've had all kinds of people tell me that so-and-so diagnosed me, my PCP or a lot of times it's a vascular doctor, because they get told that they have venous insufficiency and they go see them. And fortunately, it seems like a lot of vascular surgeons or vascular medicine doctors are on the up and up, because I've got to say maybe 30% of my patients come from a vascular doctor's office. But I think it all starts with one person. And I think once you get that diagnosis, there's probably, for most patients, at least the stories I hear, is kind of the light bulb goes off. And then you just have to get, plugged in with someone. And then once you find someone like a surgeon who treats this, myself, Dr. Schwartz, Gutowski, I think that's the first step. And then they will get you plugged in with everyone else.
this kind of surgery is very specific. Are there particular things that patients should look for when selecting a surgeon or someone that's going to care for them?
That's a great question. So I think, first and foremost, the most important thing in my mind is making sure you're seeing a surgeon who's board certified in plastic surgery. And unfortunately, a lot of the non-plastic surgeons have caught on to that terminology. So they use the word board certified and they use the word plastic surgery. But the best place for patients to check is at plasticsurgery.org. So that's plasticsurgery.org. And there's a link there to find a surgeon. And you can start with me. I should be there. If I'm not, you're probably on the wrong website. And then, but and I joke, but I think anyone on there, as long as they're certified. And then the next thing I would say is make sure you see someone who treats lipedema, because I've had patients who tell me, well, yeah, he was a plastic surgeon, but maybe he wasn't so experienced in lipedema, because I think we talked about this earlier. This is not cosmetic liposuction. This is very, very different. And there's a bit of a steep learning curve when you're doing this, and I went through that when I first started doing lipedema. You don't want to be a surgeon's first or second patient. So I think those are the two important things.
Most important, this is not a cosmetic procedure, bottom line.
Correct, absolutely.
And I think that's a point that needs to be made more with the insurances as well.
100% true. I think until that's, and that's a whole separate tide, I think, but until that changes, I think the landscape is really difficult to navigate for patients. We submit everything to insurance, and we do appeals for patients. We've gotten pretty good at it just from several denials in the early days of us doing these. So, we've kind of tweaked our letters and tweaked what we have patients do to try to get them the best chance of getting insurance approval.
Yeah. It is a battle worth fighting because, I've heard an analogy that lipedema is where lymphedema was maybe 15 years ago, under-recognized, underdiagnosed, and certainly not treated enough. Now that profile has really been raised, so may we do the same with lipedema. Let's hope.
Yeah, that's a good analogy. I've never thought of it that way, but certainly, even now, some of the things my partners do for lymphedema are some insurances consider, experimental or investigational, and they're not. There's data out there that shows that these techniques work. So, insurances really need to come into 2021 and update their policies to reflect that.
One person really can make a difference, and just the fact that there is an option here on the East Coast that is making a real effort to help the lipedema population. And you have a great team. It's a very collaborative effort. So I applaud what you're doing, and I want to thank you for your time. I also want to say, I want you to come to one of our roundtables. We have great, invigorating discussions with lipedema patients and medical professionals once a month. So you have an open invitation. Dr. Omar Beidas, thank you for your time.
Thank you so much, Brenda. Of course, anytime, I'm happy to join one of those roundtables.
Terrific. Have a wonderful night.
Thank you, too. Take care.